So I know in your role, you're not a prescriber, of medication, but something that may come to mind for some people is, is now the time to start thinking about medicine if I need it, and particularly, if it's just the antidepressants or if it's benzodiazepines like Xanax and such. Again, I know that's not your specialty, but do you have any thoughts about if people think that that's the route they should go, or just thoughts on that in general, really?
Yeah, absolutely. And not every therapist agrees on how we look at medication for people, but more times than not, we say some brains and bodies need it. And while we don't suggest that people rush out and jump on a medication, and we always recommend if you do medication that you do therapy as well, and really no doctor or psychiatrist should be prescribing medication without also suggesting therapy to go with it. But sure, some people need medication, and definitely talking to your doctor. If you prefer Western medicine, you might talk to your primary doctor. If you prefer Eastern medicine, you might look into naturopaths. I know in Seattle we have a ton of naturopaths, but they're all around the world. It's just a different approach. So there are a lot of non-psychiatric med approaches to anxiety and depression and stress, a lot of natural remedies that perhaps your primary doctor wouldn't have suggested. So that might be a reason to look into a naturopath. One other consideration, John, is that when it comes to psychiatric medications, with all due respect to doctors, typically they are woefully trained in psychiatric issues. That's really left for people that we're calling psychiatrists and also ARNPs. And an ARNP is a psychiatric nurse that specializes in psych issues. So a psychiatrist or an ARNP, if you have the choice to get prescribed medication through them rather than your primary doctor, it is what we recommend.